Are you trying to figure out if you want a natural birth, medical pain relief, or maybe a mix of both? Whether you're hoping for a medication-free experience or you can't imagine getting through labour without help, this video will walk you through all the options so you can feel confident and in control when the time comes. So far, we've explored what labour pain really is, how breath work keeps you calm, and how movement helps your body do what it's meant to do. Now we're diving into one of the biggest topics expectant mums want to understand, and that's pain relief during labour. What's available, what works, and what will work best for you. Now, there's no one-size-fits-all answer. Some women feel empowered using natural comfort measures. Others need or want medical pain relief, and that's absolutely okay. There's no gold star for suffering, and there's no shame in using pain relief. The goal is feeling safe, supported, and in control of your experience. So if you're hoping to avoid medications, or at least want to start without them, there are several techniques you can lean into that genuinely work, especially when you practice in advance. First, let's talk about massage and counter pressure. Having your partner apply firm pressure to your lower back during contractions can be such a relief, especially if you're having back labour. Massaging areas where you carry tension like your shoulders or hips helps your muscles stay loose and responsive. Then there's hydrotherapy. So this warm water has an incredibly calming effect. Whether you're using a bath, birth pool or warm shower, the buoyancy relieves pressure and the heat relaxes your whole body. Many women report that once they get into the tub or under the shower, their pain becomes instantly more manageable. And don't forget about breathing techniques. Now, there's something we've already covered, but it's worth repeating. Breath control reduces pain by triggering endorphins and calming the nervous system. Deep, slow breaths can shift you out of fear and back into focus. Visualizing contractions as waves or imagining breathing down to your baby can give you something to focus on instead of the pain. If you're drawn to a more guided method, hypnobirthing might be for you. It uses breathing, guided meditation, visualization, and positive affirmations to create a deep sense of calm and control. Some women even fall asleep between contractions. Now, another method you could try is acupressure or reflexology. These involve applying pressure to certain points, like the web between your thumb and forefinger, to relieve pain and encourage contractions. It's easy to learn and can be done by your partner or your doula. And another one, don't underestimate TENS machines either. So they are little pads you stick on your lower back and they deliver small electrical pulses. It might sound strange, but the idea is to distract your brain from the intensity of contractions by giving it another sensation to focus on. Many women swear by them during labour. You might also want to try hot or cold packs. A heat pack on your lower back or a cool cloth on your forehead can be surprisingly soothing. Now, the great thing about all of these options, they're safe, non-invasive, and completely within your control. So you can mix and match, and they can be especially helpful at home or in early labour when you want to stay as relaxed as possible. Now, if you're leaning towards medical options, because for many women, they offer a relief that's needed and is very welcome. First, nitrous oxide, also known as laughing gas, is one of the most common used medical pain relief options. It's fast-acting, doesn't stay in your system, and gives you a sense of calm without completely taking the pain away. You breathe it in through a mask during contractions, and it's completely self-administered, so you're in control. A lot of women like it because it takes the edge off while still letting them stay upright and active. Then there are IV pain medications such as morphine or fentanyl. These are usually given to you through a drip in your arm and help dull the intensity of contractions. They won't eliminate pain, but they can make early labour feel more manageable. However, they do cross the placenta, so if given too close to birth, they might make baby a bit sleepy at delivery. One lesser known option is sterile water injections. So these involve tiny injections of sterile water just under the skin of your lower back. It stings for a few seconds but then relieves intense back labour for up to 90 minutes. It's quick, effective and doesn't affect baby at all. Now the most talked about option, the epidural. This is a form of regional anaesthesia and that's delivered through a small tube in your spine. It numbs the body from the waist down and it's considered the most effective form of pain relief during labour. Many women use it to rest during long labours or when they're feeling exhausted. But it comes with trade-offs. It can slow labour down, increase your chance of needing other interventions, and it limits your ability to move freely. And keep in mind, if you're planning a home birth, medical options like epidurals or IV meds won't be available unless you transfer to hospital. You can still use nitrous oxide or sterile water injections at home if your provider offers them, but access varies depending on your midwife or location. So what's right for you? Now, it really comes down to what matters most to you. Do you want to start with natural methods and see how things go, or are you open to using medical pain relief later if needed? Would you rather go into labour already knowing you want an epidural for full relief? So some people prefer to stay upright and mobile for as long as possible and save medical interventions for later. Others want relief early on so they can stay calm and rested. Now there is no right or wrong. And you don't have to pick just one option either. A lot of women use a combination like movement and breath work in early labour, then nitrous oxide or an epidural later on when things get more intense. So here's what I want you to do. Take a few minutes to write down what you think will help you most. Choose 2 or 3 natural techniques that feel right for you. Then write down which medical options you'd be open to if things change. And finally, be honest about what you don't want. Make sure to talk about this with your birth partner and provider so they can support your choices when you're in the moment. Remember, the goal isn't to avoid pain at all costs. The goal is to feel supported and in control. Now in the next video, we'll take everything you've learned, so movement, breathwork, natural tools and medical options, and help you build your personalised pain management plan so you feel fully prepared for labour. Remember, you've got this. You are strong and you have so many tools available to you. Let's keep building this confidence. If you found this helpful, hit that like button. Make sure you're subscribed so you don't miss the next video. And I'd love to hear from you in the comments. What's one pain relief option you're definitely planning to try?